Okay, welcome to the Board of Health, Calhoun County Board of Health. We'll start this meeting at 10:01. I'd ask everybody to be respectful to the public. We're going to try and stay within our about 1 hour time frame and ask everyone to hold their questions until the public comment period. First, I want to read a statement. It has been inaccurately reported that I am against vaccines. I want to correct the misstatements. I'm not an anti-vaxxer. In fact, I may have had more vaccines than anybody up here, having worked in Africa and elsewhere. I do believe that vaccines are important and can help humanity, but should never be forced or mandated to all. God gives us free will, and I would not prevent anyone from choosing a vaccine as long as they are informed about the possible dangers and if a vaccine is actually necessary. Recently, a man in Germany personally chose to be vaccinated 217 times. I'd never recommend such risky behavior, but I wouldn't prevent it either. The public has lost trust in our public health systems. During COVID, the authorities did lie and did so repeatedly. People lost jobs, businesses were ruined, and maybe worst of all, our young students have suffered tremendously because of it. I will continue seeking the truth about COVID. The citizens of our county demand it and deserve it, and the truth shall set us free. I want to close with a quote from a letter that was written to me and this board. It is reasonable to question the value of mandates, edicts, and school closures. Your passion about the response to the pandemic is warranted. That was Dr. Thomas Hickey. With that, I'd like to move on to the first order of business, which is to review the minutes. I'd entertain a motion to accept the minutes if everybody got them.
I make a motion that we accept the minutes for the last meeting of the Board of Health.
Is there any discussion on the minutes? Okay, all in favor of accepting the minutes from the past meeting, say aye.
Aye.
Aye. Any opposed? Okay, unanimously passed. Nice. One thing I noticed in the minutes, I wanted to ask Alyssa, were you able to get a hold of the tribal members and invite them to one of our meetings?
I've not had a chance to follow up with them yet, but I will
Okay.
still on my list. Thank you.
Thank you very much. Okay. Yes. First order of new business, we want to talk a little bit about fentanyl. Fentanyl is a kind of a new drug. It's causing lots of problems, and we have the coroner here, I believe. Would you like to come up to the desk there? Thank you for coming. We really appreciate that. And we'd like to all know a little bit. I heard in the past meeting, somebody brought fentanyl up. Commissioner Weber has also brought it up. I think it's an important topic. So I'll turn it over to you and tell us what you know.
Thank you. Dana Tucker, Cowlitz County Coroner. So I pulled some stats and we kind of went through this. Yep, it's on. It's just not close enough. We kind of went through this last week in our meeting, but I can recap. So for 2023, we'll start with 2023. We've had 1,077 deaths that we have looked over, overseen, all of that stuff. And then with those 1,077 deaths, there's been 916 natural and 89 accidents. With those accidents, the drug-related ones were 49. I gave some stats to the Daily News, and I need to let them know that the one that I gave them for the 2022 was actually the full amount of accidents and not drug overdoses. So the drug overdoses for 2022 was 33 drug overdoses, and I didn't break it down to the fentanyl ones. I think there was only like 17. So out of 23, we had 49 drug overdoses, and 42 of those were fentanyl related.
Can I interrupt you, or do you want us to wait till the end to ask questions?
What?
It's up to you.
Oh, I don't care. You can
What
ask
did
it.
she say?
Yeah, let's let her finish and then we
Fine.
can.
She
question.
said it was okay. Are you
Oh,
good with that?
go ahead.
Yeah, that's fine.
So when you say 49 drug related, that's not alcohol, or is that, and are they are?
No, these are all drug related. For 2023, I did break them all down into categories of what ones were in there. And then with all of those, some of them are mixed, some of them are not. So you could have meth, so I had fentanyl. I'll just tell you since I have them if you want. So there was fentanyl, 11 just fentanyl. There was 5 just methamphetamine. There was 23 meth and fentanyl mixed. 23. There was 2 fentanyl and cocaine. We're seeing a big cocaine uptick. We're getting a lot of cocaine back. There was 1 just cocaine, fentanyl, cocaine, and methamphetamine. There was 4 meth, methadone, and fentanyl. There was 1 meth, morphine, and heroin. There was 1, and fentanyl plus other, which would just be, it could be prescription medications. It could be, just other random drugs that we don't, see all that often. That was 1. So there was a total of 49 drug-related deaths. And out of those 49, there was 42 that had to do with fentanyl. So there's only 7 deaths, drug-related deaths, that did not include fentanyl. So fentanyl is huge in our county, and not just our county, but everywhere. So, and for those that don't know, I'm sure everybody probably does, but it does not take much for fentanyl. It's 0.004 nanograms per milliliter will kill you. And we're getting, so even if you get like a
0.004,
0.04.
0.04, wow.
Yep, and we're getting it's getting higher and higher. So I can't really say if people are getting resistant to it or anything, but I mean, there for a while, we had like 11 was pretty much across the board that we were seeing when the toxicology came back. Now it's going up higher. It's a problem all over. And our county, of course, is one of the, mid counties to smaller counties compared to, say, King County or Pierce County, the ME ones where they, are seeing a lot higher, but per population, we're up there.
Just to be sure, can you build a tolerance to fentanyl?
See, I wouldn't think so because it's so potent, but there's people that if they've been doing drugs for so long and if they're only getting like a very small dosage, then it might, they might not think that, the bigger amount will do anything to them, but it still does.
I'm not sure this is a question that will stay in your theme. If it is, just interrupt me and I'll stop. If I'm a consumer in the street, and I've been buying for a long time, different stuff, so I'm an addict. It would be nice if I knew that what I was buying was going to kill me. Is there any way for someone to identify whether there's a lethal amount of fentanyl in anything?
No, we have, and one question that I've had before is how many people know that they're getting fentanyl as to those that may think that they're getting oxy or something like that. There's no way to tell because unfortunately I can't ask them. So, but
So
a
it-
lot of the ones that are the friends or whatever that we're talking to, they may think, well, there's a possibility. Well, I think right now, everybody knows that there's a possibility. So you're still taking that drug with a possibility that fentanyl can be in there. Because fentanyl has been mixed with everything, even marijuana. So, and we see a lot of the cases that are coming back that have marijuana in them. So I can't tell you if the marijuana was laced with fentanyl or if it was just the other drugs or whatever. Um,
I have a family member in Southern California who is an addict, has been for quite a while, and they say no, they know what is safe and not safe out in the street. I guess that's just that, right?
yeah, I would say I don't think so.
When you watch some of the drug interdiction shows, they'll put something on a powder, and if it turns blue, you got cocaine. There is no such thing for fentanyl.
I honestly couldn't answer that.
Yeah, if we could find that out, I think that'd be a useful thing for people to know.
One thing you said was that, you said 11 were attributed just to fentanyl?
So the ones that all of the ones that I broke down, there was 11 that didn't have anything else except for fentanyl in their system.
So we can assume that they knew that they were taking fentanyl.
Well, there are the blue pills, the M30s, they call them different things now. There are people out there that are looking for fentanyl and they know how dangerous it is, but they're addicted to it and they want it because it's such a very quick high and it's more potent than all the rest of them now. So we find blue pills at scenes, so then we do know that they know they're getting it. There's a lot of times that we don't find anything on scene. So I can't say whether they knew, they were getting that or if they did something else. But the fentanyl, they were ingesting it and then they went to the powder and smoking it and now maybe even snorting it, I don't know. But different ways that they do it make it more potent.
So there is a safe level of fentanyl? I mean, not safe in
I
our
would,
world,
I would just say no, that there's no.
but there are
um,
people who believe that they're going
I
to
would.
take a safe dosage and they miscalculate. Is that?
Well, nobody knows exactly how much are in those pills because they're not chemists that are doing it. So before I came here, I had a meeting, and I think I told you last year that up in Lewis County, they had a meeting regarding, the drugs and all of that stuff. And they said the cartel is mixing fentanyl in with everything, even marijuana. So when, they're not chemists. So when they're making it, they're just making it and they're putting it in. So you could have a handful of pills and go to a party and, I could give each one of you one and all of you guys are fine, but Rick isn't.
I've been saying that for
it's-
years.
Yeah, it's
Oh,
basically playing Russian roulette is what it is, because you have no idea what is in which pill.
Yeah, I don't think you can infer or assume anything about the person who has only fentanyl, because the stuff, I could cut sugar and whatever it is with that and say, here, this is black tar heroin for you.
So may I ask a question? Would you call this a fentanyl emergency in Cowlitz County related to any communication you might have with the health department? Or has that ever been, I don't know what the level would have to rise to be an emergency, but
Well, I think when we're seeing the drugs and they're going one way or the other, we're seeing more of one than it is. I mean, most of our, we get drug overdoses all the time. That's not to say the ones that survive, I have no idea about the ones that survive, but we have our radios on and we listen to, there being Narcan and, right and left all over the place, and those ones survive. But eventually, we're going to end up getting them if they continue.
Does Narcan help if you're overdosed on fentanyl? So it's the mechanism's basically the same.
Yeah, they're Narcaning pretty much everyone because fentanyl is so rampant that they have no idea what anybody's on, so they just Narcan everybody.
What is the age, are you seeing a primary breakdown in demographics of these folks, that these 42 folks that have passed away due to?
So I did not do that breakdown, but I know that the majority of what we're seeing are probably, let's say, in 50s. Yeah,
350.
and 30 is on the lesser side, but 30 and 50 up into the 60s and even 70s.
Mhm.
So,
Anybody under 18 or under 20?
no, I don't believe I don't recall any of those ones.
Can they vape fentanyl?
They can smoke fentanyl.
Okay.
So yeah,
Yeah.
I think you can do pretty
That's a
much
concern.
anything with them. Yeah.
Can you talk about who, and we've gotten probably way off your presentation.
Oh, that's good.
Who all in the, what first providers in our county are trained and use Narcan? Is that what it's called, Narcan?
Yeah. So any medical, so EMS, and then you have fire departments, a law enforcement carry it, we carry it, because we go into scenes all the time and you never know. So, we're right there in the middle of everything, and fentanyl will go through. I mean, the powder, anything like that, if it's in the air, you don't want to open up a window. You don't want to do anything, because if it gets in the air and you breathe it in, that's pretty much it. And then if you touch something, we don't ever go anywhere without gloves, of course. But I mean, even that, some gloves will go through and it goes right through your skin. So, and like I said, it doesn't take much. And
You don't, I thought Narcan was available without a prescription.
well, if you could let me know that and we could get it for free, that would be great.
Oh, no, I just,
We
I
had
know
to
it's
get a
all over the
prescription for
place.
it, yeah.
Oh, okay, so you do need a prescription.
Well, they have them in the vending machines in Oregon, I've been told.
And
Okay.
But
in Washington, they're starting vending machines as well. And also I went to an Indian powwow last year and they handed them out. So I got a few at
Did you
home.
check with Alyssa about the powwow?
No,
I don't
before she
believe you need
joined.
a prescription for
Okay, thank you.
Narcan. That doesn't mean it's free. It just means you
No,
don't need a
it-
prescription
yeah.
to obtain it.
well, when we looked into it, the sheriff's department had to have one. And that might have been in the past and maybe not now, but they gave me the information on who to contact. I contacted them. They gave me the prescription, sent it over to the hospital pharmacy, and then we went over and picked it up. And I think for 4 of them, I don't know, that was a while ago, but I think we paid over $200 for
4?
the
Wow.
total. Yeah. I mean, for us, we have to pay for it, but everybody else gets it for free. And we're
Yeah,
we're
so
right
that's
there
nice.
trying to take care of what we need to do, and we don't get it for free. So if you guys can figure out how to get it for us, that would be amazing.
Yeah, I think
I know when you go to the doctor's office or even the dentist's office, at Kaiser anyway, there's a sign that says, if you want, we'll give you some. No,
Oh,
that's not
Narcan.
good.
And I also think if you get a prescription for any kind of serious medicine, they send it home with you or make that offer for
Yeah.
you.
Well, I just know that we had to pay for it.
Mm.
So, and it's not cheap.
Does
So-
doctor know anything about that? Can he speak to that?
Narcan.
What's the specific question?
Do you need a prescription for fentanyl? Where is it
Or
available?
not fentanyl, Narcan.
Narcan.
Well, you don't need a prescription for that either, obviously.
Hi, Dr. Steve Greger, I'm the deputy health officer. You can go to a pharmacy, anyone can go to a pharmacy and get Narcan. You do have to pay, you often will have to pay for it, but there are other ways to get it for free. So a doctor doesn't have to write a prescription. That's correct.
And do you have a sense of what the cost is?
No.
Oh,
Walgreens has it advertised $45 for a 2-pack.
Wow,
$5.
that's expensive.
Well, since we've gotten it, it's gone down a little bit.
Prices come down.
Dr. Krieger, while you're up there,
Sure.
do you have any ideas about what we could do as a county? I rack my brain every day about how to communicate and how to
Yeah.
prevent death, and our kids especially. And
Yeah.
I don't know if there's been talk back and forth between different entities about the answers or ideas.
Although if I could interrupt, we're not seeing death in the young ones, are we? It was the older group that,
Right now, the majority of
risk.
them
They're at
are
risk.
older, but I think it's very important to get the education and stuff out to our younger kids, because what they're doing is, they're very vulnerable right now.
Very much.
Somebody comes to school and says, hey, try this.
Yeah.
And that's been throughout all the years,
Yeah.
but right now we're just seeing stuff that's so toxic and doesn't take much, and it's being mixed with everything. And when we do education and stuff through the schools, which we've been invited over multiple times, is I tell them, don't take anything that you haven't gotten from your doctor or from a legitimate store, even marijuana, because of course, a lot of kids, marijuana is the safest thing. Well, not right now.
It's
Not if you're not getting it from a dispensary, because it itself can have fentanyl in it. So right now we haven't, and I hope it stays that way. But then again, once they're our next generation, once they get up there and stuff happens, then they'll fall right into the same stuff that everybody else is.
Yeah, I hate to
in,
wait until it's
unfortunately.
become a huge problem before prevention is really a better idea.
I just want to
Yep.
mention, we have planned in our priorities and budget discussion, talking about interventions on those types of things. So some of that we plan to talk about in a little bit.
Great.
Great.
Thank you.
And I did pass out, I was online trying to see what other jurisdictions have done, and I did find a 5-pronged plan that Baltimore, which is of course a bigger community with bigger issues, but it appeared to me that their 5-pillar strategy looked reasonable and could be scaled down to fit our community. I passed out copies for these guys, but I'm sorry I didn't bring one for you. But I think that gave the health department one.
I'd just like to say that when it first came out fentanyl, I was thinking that if people are taking fentanyl and they want to use fentanyl and they know they're getting fentanyl, or even if they know that it's an oxycodone mixed with a fentanyl, if they do that and they take it on purpose and they have a problem, they die, well, that's kind of on them. On the other hand, if somebody is getting fentanyl and thinks it's marijuana or thinks it's cocaine and it's laced with it, to me, that's a poisoning.
Yeah.
Somebody has poisoned them. And I'd just like to point that out. And
Well-
one more thing, Dr. Krager, no more deputy.
That's,
Or
oh,
what?
thank you for correcting that. I appreciate that. Health officer.
I noticed that too.
Okay.
Do you have some more comments on it?
Oh,
Thank you.
I was just gonna say, right now, I mean, in the past, it was, it was probably what you were saying is, some people were getting it and they didn't know it. But now it's kind of hard to think that they don't know that it's a possibility, just because it's so rampant and it's with everything. I think that most everybody out there probably knows that when they go to get something, it could possibly have it, and they're still taking it, so.
Teenagers, don't you? We went to a workshop recently put on by Care Coalition of Kelso. It was very good at the First Baptist Church, I think, this last Monday or Tuesday, but it was talking a lot about vaping and how they're using vaping to introduce marijuana and all kinds of things. And they're talking a lot more about marijuana being very dangerous for youth. And it's much more powerful than it used to be. It's like 40 to sometimes 90% pure, depending on how you're using it in oil or other ways. And I learned a lot the other day. I didn't know that. And I hope kids know that when they're vaping this stuff, because it can cause psychosis in a much earlier stage if they're youth. It affects the brain. You probably all know that. But I didn't know about the vaping and how powerful the pot has gotten. So it's ridiculous. We're
Well,
just-
I think we're seeing that with almost everything, though. Marijuana, yes, I agree. I think we're seeing that with almost every other medication or not drug out there, is way more potent than it ever used to be. Such just cocaine on one note, it's coming back and people are dying right and left with cocaine too, because, you know, in the past, they do cocaine and I don't think it was as potent as it is now. So we're seeing that with everything.
Thank you.
I'd just like to add the workshop from the coalitions was specifically, there was a person there who works in the Kelso High School and talked a lot about all the problems that the youth are having there. And I did follow up and ask him about fentanyl, and he said, no problem so far, but like you said, it could definitely come. And especially what we did hear is that a lot, I don't know the percentage, but a lot of the kids are getting this was typically marijuana and vaping products from relatives, even their parents. And so if it's handed down as opposed to, like you said, from the dispensary, that could be a big problem. So,
Yeah, I don't think anything is safe if you're not getting it from, with a prescription or from a dispensary. And that's just what I try and tell the kids. You're getting it from a friend. I don't even say,
Yeah.
you know, a dispensary or your parents, because I don't want to say that.
yeah, we have a lot of work to do on that, trying to at least prevent the kids from getting into, don't get dead.
I don't think we know how to do that. You're
No.
18 years old, you can be drafted, you can be sent to get killed, but you can't buy a bottle of booze. That's never set very well with anybody, and clearly it doesn't work.
Anybody have more questions for Dana?
Just appreciate your time. Thank you.
Yeah, we thank you very much for coming and giving this presentation.
Yeah.
Thank you, Dr. Krieger, for your input as well. Of course.
It sounds like you got,
Please. Sure.
Can I add real quick, 2022 fentanyl-related cases, I think were 29. And I believe it was 33 was the amount of drug overdoses. And this year was 49, or sorry, 23 was 49, with 42 of them being fentanyl-related.
So increasing.
Is there a way to track the overdoses and the recovery? Is it so rampant now that you can't even figure out who's just died and been fixed and they're off on their, you know, little adventure again? Is there any stats, any way to track that or keep track?
I can only track the deaths that have come through my office.
Through the EMTs, or is there a way to coordinate that kind of thing where we could track it?
There might be.
Yeah.
I don't know what the,
Oh,
what.
she's
what
shaking her head.
EMTs
Gina's
do.
shaking her head.
There is some data out there from EMS. They report when they administer Narcan. And that's sort of where it ends. You don't really know if the person was overdosing or not, but there is some data. I can look back at the last report.
It'd be good to know. Okay, thank you.
That was actually my question, if there was a way to get a countywide metric of how much Narcan is administered, even
Yeah.
by the services.
Absolutely. I'm
Yeah,
curious.
So it's,
that's a good point, and we'll follow up with Gina and EMS on that.
I know it's real common, and I know a few people that they seek out just fentanyl. They're drug addicts and they do fentanyl because it's just so cheap. Actually, all drugs are cheaper than they've ever been right now. Meth is just dirt cheap, you know, everything is just super cheap.
Cheaper and better.
Yeah, and I didn't realize I was talking to a guy I've known for years the other day, and he told me he's overdosed on fentanyl twice and been Narcaned. And he's still kicking, but
And I understand that you can only do that so many times in a row at that one incident, isn't that right? Where they go back and use again and they have to re-Narcan in a few hours or minutes or, and it seems like, Dr. Krieger, is there any too much? I mean,
much
there's
Narcan?
repeated, well, there, okay, you can just keep on giving it to the, doesn't damage your system or, it's too bad.
I think though you bring up the question of, I want to know how much Narcan is used out there, but suppose it's only used by 25 people and the other 500 use it one single time, everybody else use it 20 times.
Yep.
yeah, I've heard of multiple doses for one overdose.
Yeah.
But that's a good point that Gina made. You know, you don't know how many of those were actually an overdose or just a preventative. Like when my truck was rear-ended by a guy who passed out, the EMTs came, they immediately gave him Narcan. He was overdosing, but he was kind of just unconscious and you know, and in the end, they made the right choice because that's like their procedure to just to do it because you never know.
You'll hear the term frequent flyers now.
Yeah.
I do know that, when we were talking to some EMS and stuff, they had talked about, a few of them that they've had to put on Narcan drips on the way to the hospital because they kept overdosing, so they're on a Narcan drip. Because once it gets in there, then they start overdosing again. And so they would have to put them on one of those, so.
Thank you.
Thank you.
Crazy.
That's scary, scary stuff.
I just wanted to say something really quick. I'm really glad you're addressing this because I was talking to the principal of the high school in Castle Rock, and she said that her main concern is the fentanyl problem there.
In Castle Rock?
What'd you say?
I think Castle Rock School District's main problem is fentanyl.
Oh, I've heard that. Yeah,
That's interesting.
I've heard that.
That's not the same as Kelso. Castle Rock a little hardcore.
Possibly.
Any further questions for the coroner? Please.
It has to do with self-harm. Do you have any idea how many suicides we have in the county?
Yes, let's see here, I think I have that on. So last year, we had 29.
29?
Yeah, in 2022, we had 25.
Okay.
29. 2023, yes. And then currently we have, well, this was a couple weeks ago when I pulled this and we've had a few since. So it was 4, so I'd probably say maybe 6 now, currently. And then we still have quite a few out there that are pending toxicology, but there's been 9 confirmed overdoses this year, but there's more than that because there's quite a few up still pending.
Is that a potential overlap as well of suicide and overdose?
No, we've only for suicides and related to medications or drug related, we've only had, maybe 3 total. So most of those are ruled accidental because we don't have anything else to go off of to say that they did it intentionally.
So just to clarify, I think he asked if how many suicides there were. So was it 29 suicides?
There's so last year, 2023, there was 29 suicides, and I did not break that down for what it was, so.
Okay.
Just as probably an ignorant statement on my part, I think of suicides as being of telling us that a message about the health of society. And I don't know what that message is, but it is something that I would love to see emphasis on breakdowns of all kinds of axes, knowing age, economic situation, all kinds of things. I'm not sure that would be something you do, but HHS might be able to
For our
look at it.
suicides, they're usually in probably 40 and younger.
There, I'm sorry.
I would probably say not having those stats with me, but the majority of the suicides that we see are probably 40 and under.
Yeah. So anyhow, I think collecting that kind of data and doing a little more homework on it would be useful. But again, I'm ignorant in that area.
In terms of youth suicide,
We do have quite a few of those, yes.
quite a few.
Mhm.
Thank you.
You're welcome.
Thank you.
Thank you.
Thank you very much again. We appreciate you guys coming and giving us this good presentation. It's important, another problem to fight with and don't know how.
Yeah, exactly. Thank you.
Thank you. Okay, moving on to the next item. There is a public service announcement, a public health PSA contest. And Gina and Carol from HHS would like to tell us a little bit about that contest. By the way, the agenda says winners. It's not the winner yet.
That's correct. Thank you. So we have a public health PSA contest underway currently. We were hoping to announce winners today, but we've extended the deadline. So we have, the deadline is April 1st by midnight. We have some extra flyers up here in case anyone is interested to take one to hand out. We're hoping to get some more entries so that we can take a look. Last year, we had 2 youth that submitted to this contest, and it was really neat to see what they did with that. So we don't have winner today, but wanted to just give a plug for the contest anyways. Deadline again is April 1st, and yeah, there's extra flyers up here.
So if anybody knows some youth that are creative and want to make a statement, please give them this flyer.
And I'll also add, just as listening to the fentanyl discussion, there's a town hall in Castle Rock coming up in April 17th, put on by some 8th grade students, where they're going to be discussing with the community the dangers of fentanyl. So I just caught wind of that the other day. So if anyone's interested, I'm happy to share the details.
Will they be having some kind of flyers or announcements other than what you just did?
I'm not sure. I think I saw it posted on Facebook. It'll be at the middle school. So I took a picture of it with my phone, but so I haven't seen any flyers, but can share the details if anyone's interested.
Okay, thank you.
Thank you. Okay, so, and just the PSA contest last year was very cute submission. It's nice to see there are quite a few kids out there that do want to try and help their fellow students, prevent them from doing bad things. Okay, next up, you guys are perfectly timed there. I did that on purpose. Let's talk about the 2024, well, the budget, the HHS budget.
Yeah, so do they have the handouts? Do you have the handouts? There's all kinds of colorful.
Ooh, nice.
Okay.
You.
While she's passing that out, the county's on an annual basis, January to December. Is that correct? The budget?
County budget, it's a 2-year budget cycle. Mhm.
Okay.
What we have in the colorful, the graph chart that looks like has the pie graphs, et cetera, is the 2024, what has been approved for the 2024 budget. So we'll start with
we'll
So,
start.
so just to be sure to her question, as we are on the January to December
Yes,
fiscal year for them.
yes. Yes. So what you have a couple handouts. This one that has the pie chart kind of graphs on it shows the top half shows the revenue, and it shows just the percent breakdown. We anticipate our total anticipated revenue about 3.9 million, combination of primarily state and fees and permits, with a tiny bit of federal funds, birth and death certificate fees in there. The bottom half is expenditures, and it's broken down by program. So you can see the percent breakdown by program area for the expenditures. And this is really, I know we've talked a little bit about this. This is, as I mentioned, what has sort of been approved in the county through the county budget process. This supports kind of our basic health department operations, to have our communicable disease nurses, to have our environmental health staff, those types of things. You can see a further breakdown on the back side of the expenditures by program. It just kind of drills down a little bit deeper into the program areas in terms of the different work. And then it also, the bottom kind of square graph includes the FTE by program. And that was based on the previous year's time billed to the program areas by staff.
Quick question. The environmental health fees are determined such that they cover all the expenditures of environmental health. So we're not using environmental health fees to support other things. They're,
Correct.
okay.
Yep. So that's an overview, like I mentioned, of our health department side. We also brought an overview. I know we've talked last time about the foundational public health services funding. So we also have a handout for, oh, and I'm sorry, you don't have that one yet.
Can't read fast enough.
So we have a handout that is an overview of the foundational public health services funding for the current contract period, which is July of 23 through June of 24. So I know some of the questions that came up before were about what it can be used for and how much. So our total grant for this year was a little over $1.4 million. And you can see the breakdown by different areas underneath where it says spending plan. They have the funding that they sort of allocated into different areas of communicable disease, CHA, CHIP, EPI, life course, and other capabilities. And there's descriptions underneath that talk about those. So for this year, we anticipate returning to the state about 1.1 million of that at this point. As we talk about a couple of our next information is about our different priority areas and potential strategies. So this is potentially a source of funding that we could utilize to support some different strategies in the community. Any questions on that before we move on?
So Gina, the way the budgeting works is that we budget the allocated amount. That's all in the budget right now.
Right,
Because we don't know, theoretically, we don't know how much of it we're going to spend.
right.
And then we pull that out towards the end of whatever the budget cycle is.
Yes, that's correct. Yep.
And one question I see, I'm very happy to see one of the top priorities is substance youth and specifically youth prevention through assemblies and educational opportunities, which is something that I've been trying to push for a while. But is there, as far as I understand, there's nothing, nothing's been spent on it yet, but is there some funds available for that?
Yes, so the FPHS funding that that we have unallocated essentially is what is available that we could potentially use to support some of these activities.
The
The Foundational Public Health Services funding, so would be this colorful one that's on the
this one.
screen.
Wasn't there an issue with, we just simply don't have enough time to try to get some of those dollars spent by the end of June?
Yeah, I mean, so we're getting to the end of the fiscal year. We actually do have one project in the works right now, working with one of the prevention coalitions who had reached out for some assistance with a guest speaker to come. So that's something we're looking at. And we'd love to do more of that, to get those opportunities for schools and kids to get some more education and hear some more. So we could certainly put more of an effort, and that's why we sort of identified it as a priority area for us, just to get that information out consistently to that younger age group.
So do you see a process by which that can happen I'm very interested in school assemblies. That's been kind of one of my interests. And I don't know how the action plan would work as far as if you would go approach the schools, or you just let the coalitions handle it, or do you see yourself as kind of a spokesperson that would direct the possibility of these assemblies? Because I think that's really important personally.
Yeah, so I think if there's support from the Board of Health to engage further in this type of work and to be able to commit, a chunk of money to doing those types of activities, we can certainly do some more targeted outreach to the schools and the coalitions to engage in, deeper conversation about what that looks like and what their needs are for getting that type of, for what they're looking at and what we could help support. And we could certainly do that.
Thank you.
So I keep interrupting you. I'm so sorry. So it seems like this is the right time to start formulating a plan on how to develop opportunities for us to support your priorities using these FPHS funds for the next fiscal year. Is that correct?
Yeah.
And
we
is it
do-
about the same amount of money that you're looking
To the
at
best
next
of our
year?
knowledge, it'll be about the same amount of money,
Okay.
starting July 1, so that they go
Just to
July
be
to
clear,
June.
you meant the contract year because they're not aligned.
Say that.
Our fiscal year
The
is not
fiscal
aligned. It's a contract year you're talking about.
Right.
Yeah, that was basically what I wanted to know, is what you anticipated for 2024, 2025. And so we can spend some time looking at maybe longer term strategies as well, not just some of these short term ones. Because I'm really interested in and I'm not super familiar with this because I don't work with this regularly, but what are the actual evidence-based strategies that tend to work for drug prevention? Because I think there is things that feel really good that might not work in the long term. So I'd be curious to know what the Department of Health, as well as some other agencies and organizations, view as really evidence-based that we can maybe think about for long term.
And I have a thought as SUDS substance abuse treatment opportunities. I hear all kinds of things. Well, I hear one day that there's a lot of opportunities for people to get the treatment. And then I also hear that there's nothing available and no in-house, is that what you call it? Inpatient. So I'd be interested in knowing what actually is the situation out there for folks who are already addicted. What opportunities are there for treatment? And if that's something that this community needs more of, or do we have enough? And if we need more, is that something that can be built into this next budget for the contract for the FPHS funding?
I've heard similar comments in the community about there's access to treatment, outpatient treatment. I think the inpatient treatment is a little bit trickier, and tends to be shorter term from my understanding. So I've just anecdotally have heard from folks that it would be helpful to have
Yeah.
longer term stays instead of like a 30-day stay, but more, a 60 or 90-day stay. And I don't know that those options are readily available, especially locally.
And
If
the
you're-
effectiveness of those.
Yeah, if
Mhm.
you're talking about adolescents under 18, we have no facility here. There's only
Mhm.
for drug, there's only 4 in the state. And I think the nearest boys is up in Seattle and the girls is Ferndale. For mental health, there's only 1. We send some of our kids to Utah for that. We're actually looking at a program over in Spokane. I think there's 4 or 5 of the tribes over there put together that I understand has some, on paper, what I've seen has been communicated to us that it has pretty good success rate. So I think we're going to do some investigation. I'm kind of mixing over into the VOCC, but we're taking a look at some of that. But you're correct. If you're talking adolescents, we have nothing in our community for that.
Want to put a quick plug in for the data collection too. I know you guys are probably sick of me talking about community health assessments, but I think that when we look at like these different priorities, data, epi, all that overlaps all these areas, right? And understanding what's going on is critical to understanding whether it's substance use, STIs, chronic disease, and what needs to be done in our community. And I see that right now we have nothing allocated for that kind of box. And that would be something I think is important to move forward in an informed and productive and effective and efficient way.
So in terms of process of moving this forward, does it make sense for you guys who've heard comments from the Board of Health to put together a draft vision of what it might look like for the next contract period, and then present it to this board and have this board take it apart and rebuild it or tweak it, or does that make sense in terms of process?
Yeah, I mean, I think if we talk about what some of the priorities are, and if this board, agrees on some of those priorities and are supportive of certain strategies, we could put together just sort of a work plan for what that looks like. And of course, we meet monthly, so we can give updates as we go along. But it would be helpful to sort of have something kind of set that we could go off of, that we know that the Board of Health is supportive of and has given sort of direction to continue on. We did identify a couple. I know we've been talking primarily about substance use. We did also identify on here access to Narcan for first responders. That's another area that I know we've heard of, that need from law enforcement, and we heard the coroner talk a little bit about that too, of there's some programs available. There's some programs available where you can submit to the state and get a Narcan sort of individually. I think a lot of the free opportunities and for law enforcement have dwindled over the last few years. So I think there was a big push a couple years back, and they've kind of tapered off. So I think that is a need for law enforcement or first responders to be able to have that sort of on hand. And it has a shelf life and all of those things. So I think it's kind of expensive and cumbersome, but that's something we sort of identified because we've heard that from the community as well, and could be something that these funds, as well as the opioid settlement funds, could potentially support if there's interest in doing that.
So this really is the health department's priorities in terms of what they would like to see for these FPHS funds.
Yeah, we outlined some potential, what we've sort of seen in the last few years, priority areas, as well as some potential strategies. We didn't get into really long-term. I think Alyssa mentioned, like long-term deep strategies, but these are sort of a starting point in terms of what that could look like. So substance use was one of those areas. STI and STDs was another area, chronic disease prevention and environmental health. And I'm happy to go into some more specifics with the STI and STD. We've really seen those the cases go up over the last few years. So some of the ideas around doing some more education with local healthcare providers, increasing testing through at-home testing. There's a lot of discomfort with going in to do this type of test. So there are some at-home options that people can choose to do, and increasing treatment opportunities for partners, working with the Community Health Partners Free Clinic and some of their work around this, as well as increase our partnership with the jail for some work around STI and STDs. So it's just a couple areas we could look at.
If I might, I think the comments by Alyssa and Mary Jane were spot on. And I look at this as too much on the light side. I would prefer seeing something that has priorities listed as well as budgetary allocation and just fleshing out what makes that, because there are lots of problems out there, and I'm saying solving one particular problem might consume all of the budget, and that's probably not a good trade-off. And I think ultimately the function of the Board of Health would be to put their stamp of approval on the plan.
So as I look through the information, first of all, thank you very much. This is great information. And I'm gonna make some comments, and it's not really a criticism, but I'm a firm believer that your priorities are reflected by your budget, not charts and not public relations, but the numbers. What you spend is what our priorities. And despite our conversation today, we've not mentioned anything about the number one priority for the HHS, which is environmental health services. 55% of our budget is on environmental health services. And there's a chart with a whole bunch of boxes on it that talk about all the activities, the permits that have to be given by the health department. And it's an incredibly important work that is done, inspecting water quality in wells, inspecting water recreation, water quality, making sure those swimming pools are healthy. Restaurants have to be clean. We shouldn't shy away with those. That's the number one priority of our department. And the secondary priority, as is listed in some of your documents, is 30% is spent on community health. And that's where we get to community health assessment if we choose to do that. We need to up that priority. That's the substance abuse, which is not treatment. We don't provide the treatment, but it's education prevention. Those are the programs that we supported, and we don't do very much of that. There's not much money spent on those ones. STDs, we're identifying, they get reported to us. And then the chronic diseases that, again, have the potential for getting out of control. So it is exciting. And then you've also provided us with some interesting statistics that when you get right down to it, the number one cause of death in Cowlitz County is cancer, followed by heart disease. And then they list COVID as number 3. And unintentional injuries might be the number 2 driver for premature deaths. So this is some of the data that's been collected that should inform our decisions on what, what the need is. And are there strategies that can help address those things that aren't already being done? It's just that the headlines follow illegal drug usage and the deaths because it's also related to criminal activities as well. So again, this is a wonderful information for us to kind of internalize and Then the last one that you presented was some financial data about the opioid settlements. Some new information is, I remembered 2 settlements that we've signed off on, but there's a third one in the works as well. So that will be providing several millions of dollars over the course of the next 20 years or so. That'll be available for addressing opioid misuse. And I stole your thunder but he told us we only had an hour and we're done with the hour, so.
Yeah.
Hey, that's okay.
I mean, this is just really great information. It's the
Yeah.
best set of data for the health department that I've seen since I've been on the commission, so.
Well, we've been looking forward to this conversation, and I think Commissioner Weber's point, these were some of our initial priorities, and if the Board of Health is in agreement with that, and we're happy to drill that down further and then add some of like budgetary cost and things like that. And it, essentially will turn into sort of our work plan in that sense, and what we work off of to do some of this work. Commissioner Weber went through quickly several of our handouts that we have provided. So some of it, the one that says by the numbers is 2023 information in terms of the different program areas and what we have seen. And then he also referenced our leading cause of death report. And some of that information is what kind of how we landed on some of these priority areas. I'll just quickly mention the other priority areas: chronic disease prevention. We touched on sort of increasing outdoor activities, enhancing school community gardens, supporting workplace wellness programs. Another idea that we saw from another community was increasing access to water bottle filling stations, which is kind of a small something, but might be helpful for people in the community. And then with environmental health, we identified increasing solid waste disposal events. I don't know if all of you are familiar with our tire event we try to do each year, where we open up and people from the community can come and drop off their tires. We often see them piled up in yards and whatnot. So it's just a free tire drop off, and we collect a lot of tires through those types of events. So it would be great to look at doing some more of those types of activities, and maybe not just around tires, but other types of waste removal as well. And then we also,
So what's the public health tie-in with tires? What happens?
well, they often sit and pile up in yards, fill up with garbage, et cetera. Mosquitoes, all of it just tends to, the same with like Hulk vehicles and just kind of builds up and causes some hazards, or can cause some hazards. So the tire removal event, they take the tires and recycle them to use for like track resurfacing and things like that. So
Before I became a commissioner, I remember a huge controversy about the county having to condemn somebody's property east of town because they had 20,000 tires on that property. And it was quite the breeding ground of rodents as well as mosquitoes.
And when we have those tire events, we do have people that get their own special invitation.
Yeah.
yeah. Yeah, so we'd love to see more of those types of opportunities where people can come and it's, doesn't cost, and we can figure out how to help them dispose of some of those items. We have also talked about free water testing. I know the last couple of years, we've heard a little bit about arsenic in some water in private wells, and we do some water testing with like the shared Group B systems. I think it would be great to look at free water testing for private wells as well, so people can have an understanding of what's in their water, just for that information, and be able to make decisions from there. But not a requirement, but just an opportunity to see what that looks like. So that was just another idea that we had around that. Certainly, this is not an all-encompassing list, and if there's other priorities that the Board of Health has in mind, or something that we didn't hit on, or that you guys have identified, that we want to look at, we're happy to add other items as well.
And we can email you, I'm assuming, with ideas.
Sure. Yeah, sure.
Any further questions?
Thank you.
I think that's, yeah, we're gonna have to come back to this. It's, a lot of, gotta narrow the priorities down, but
Mhm.
this is a pretty good start. I appreciate all the work you guys have done.
And I also want to make a reminder of a coming attraction in April. Shannon Hoskins, our contracted epidemiologist, will be coming, and her and Dr. Kreger will be presenting on opioid overdoses.
Drug
or
overdose.
Drug overdoses. So there will be a data report coming on that, talking about trends, and may drill down a little bit into some of those, the age conversations and things like that. So that will be in the April meeting.
Is it possible to get that information emailed prior to the meeting so that we can be prepared to have that intelligent conversation about that?
I know
I
she's
don't want to
working,
push you for time.
she's
but-
working on the report. As soon as she has it ready, then we can send it out.
you.
Maybe a few days before the meeting.
That'd be helpful. Any further questions, comments? I'll open it up to public comment. If anybody has any comments on anything? No? With that, no hands? With that said, let's adjourn the meeting at 11:07, and I thank everybody for coming.